must state that for safety, honesty and cautious reasons, the information in this video was gathered through research on the internet. I am not telling you to do anything in particular. Your choices are of your own volition. Seek medical advice for further knowledge. What is the thalamus and its function within the brain? The thalamus is a pair of egg-shaped grey matter structures located deep in the brain, above the brainstem, acting as the primary relay station for sensory and motor signals travelling between the body and the cerebral cortex. It regulates consciousness, sleep and alertness, filtering information to prioritise attention. Key functions and characteristics. Sensory relay. Processes and sends information input from all senses except smell to the cerebral cortex. Motor control. Relays motor information to aid in movement and coordination. Consciousness and sleep. Plays a crucial role in regulating wakefulness and alertness also, meaning how sharp your senses are in general. Cognition and mood. Involved in memory, emotional regulation and attention. Structure. Composed of numerous nuclei that specialise in different functions and constitute most of the diencephalon. Location. The thalami are situated in the forebrain, one in each hemisphere, acting as a bridge between the cerebral cortex and the midbrain. What happens if it is damaged? Damage to the thalamus can lead to severe issues including coma, sensory deficits or movement disorders. What is the diencephalon and its function? Diencephalon is defined as a mass of grey matter located between the optic chiasma and anterior commissure to the midbrain. Comprising the thalamus, hypothalamus, subthalamus and epithalamus, and play a critical role in consciousness, organ functions and homeostasis. The diencephalon is one of the main vesicles of the brain, formed during embryonic development. What statement best describes the diencephalon? It is responsible for the regulation of our most basic homeostatic functions. It contains the relay or control centres for sensory processing and autonomic nervous system function. Right, so we've done the diencephalon. So before we carry on with the main video, we've got a couple more words to get through that you might not be familiar with. So we'll start with what is a vesicle in the human body. This is a small sac formed by a membrane and filled with liquid. Vesicles inside cells move substances into or out of the cell. Moving on to the next word that you might not be familiar with. This is homeostasis. This is the body's ability to maintain a stable, constant internal environment, meaning temperature, water and blood sugar levels, despite changes outside, keeping conditions optimal for cells to function and survive through self-regulating adjustments. Think of it as the body's internal thermostat, always making small changes to keep everything balanced, like a thermostat keeping a house at a set temperature. The key aspects. We'll start with stability. It's about keeping things within a narrow, ideal range, not necessarily at one exact point. Regulation. Uses feedback loops like nervous system signals and hormones to respond to internal and external changes. Examples: regulating body temperature, blood glucose, water content, and blood pressure are all crucial examples of homeostasis. So now you know, homeostasis is your dynamic internal balance for survival. Right, now back to the main video after that little detour. What is the main function of the thalamus? The thalamus is your body's information relay station. All information from your body's senses, except smell, must be processed through your thalamus before being sent to your brain's cerebral cortex for interpretation. What is the thalamus in easy psychology? The thalamus is the brain's central relay station, directing most sensory and motor signals to the cerebral cortex. It plays a vital role in sensation, movement, attention, sleep, and memory. Each part of the thalamus, called a nucleus, has a specialised job processing different types of information. Damage to the thalamus, the brain's sensory relay station, disrupts signals, causing varied situations like memory loss, chronic pain, which is thalamic pain, sensory loss, numbness or tingling, motor problems, being weakness and balance issues, vision impairment, language difficulties, which is aphasia, along with attention and sleep disturbances, and potentially coma in severe cases, affecting nearly all senses and higher cognitive functions. Signs and signals vary, but often include chronic pain, numbness, confusion, memory problems, and movement disorders. Detailed explanation: signals of thalamic damage, sensory issues, numbness, tingling, reduced sensation or hypersensitivity, which often leads to severe chronic pain, thalamic pain syndrome. Cognitive deficits: memory loss, being amnesia, difficulty with attention and learning, decision making and concentration. Motor problems, being weakness, tremors, balance issues or impaired movement. Talking of those tremors, well, have you ever felt that sensation where your body all of a sudden starts to jolt and just like shakes? It feels like something's walking through you. That's a kind of a tremor. It's a funny sensation. Language difficulties, trouble understanding or producing speech. This is aphasia. Vision problems, double vision, being diplopia, or loss of half the vision field, hemianopia. Sleep disorders, insomnia or excessive sleepiness. Emotional changes, lack of interest, apathy, agitation or depression. In severe cases, some can lead to coma or seizures. Why it happens: the thalamus relays sensory, being sight, sound, touch, taste, smell. What is it saying smell there? I thought it didn't do smell. You know, as I'm doing some of this research, right, I'm reading certain topics here, and then when I click somewhere else to look somewhere else, some of it, sometimes, not all the time, but you can come across words that are not meant to be in there. Because if you've just told me, right, a whole few paragraphs that it doesn't include smell, why is it when I've then done the next piece of research on the page and screenshot it to put in the slide, it's included smell? So I didn't notice that when I was doing the editing, right, to put it onto the slide. It's only when I've come to do the voiceover and I'm reading it and then it's included smell. Immediately, I'm thinking, hold on a minute, you just told me a few minutes ago that it didn't include smell, so why is that word in there now? And it just caught me straight away. So I've gone back to the research again to have a look, just to double check, and I was right, it doesn't include smell. But as I've inputted that paragraph there, the word smells there, as you can see. So that's why I've had to double check. You understand? Yeah? So this is how that slide should have sounded. So why it happens. The thalamus relays sensory, being sight, sound, touch and taste, and motor signals to the cerebral cortex. Damage, often from stroke, traumatic brain injury, or multiple sclerosis, interrupts these crucial pathways, misinterpreting signals or blocking them, resulting in the wide range of neurological ailment signs. Potential treatments. Treatment focuses on managing signs through physical therapy, cognitive therapy, speech therapy, given prescriptions for pain, and sometimes deep brain stimulation. Can you live without a thalamus? The answer is no. You generally cannot live without a thalamus because it's a critical relay station for sensory and motor signals, consciousness, sleep, and alertness. Severe damage often leads to coma or even worse. While some parts can be damaged, the entire structure is vital for higher brain functions, acting as a central hub for the cortex. Can the thalamus be repaired? Sensory re-education exercises can be a helpful aid in treating thalamus damage. These exercises are designed to help the person relearn the sensation and perception of the body's senses by engaging them in activities that involve sight, sound, touch, taste. There you go again, smell. It's not even meant to be there. Sure. See, now I'm just going to go back to the editor real quick, make a quick readjustment and remove that word. But I've got to stay on top of this because now I've noticed it. I've got to make sure everything else that I'm pulling up doesn't have the same kind of effect. You know what I mean? I've got to stay on top of these things, you know, you can't trip me up on it. Yeah? This is how the slide was meant to sound. These exercises are designed to help the person relearn the sensation and perception of the body's senses by engaging them in activities that involve sight, sound, touch and taste. You see there, yeah? That's the thalamus actually working, yeah? Cognitive function. You see how I noticed those little two words that were there but weren't meant to be there? Focus, stay sharp, be alert, cognitive function. That's the thalamus in action right there, yeah? Cool. That wasn't planned at all. That was a higher power giving me a demonstration of the knowledge I'm actually putting out in real time. I hope you understand what just happened, you know. Can surgery be done on the thalamus? The primary aim of thalamic surgery, because of lesions such as tumours or vascular diseases, is not only to achieve adequate exposure of the surgical target area, but also to minimise the risk of injury to the surrounding anatomic structures. Anatomic structures. You see how it goes sometime? Raw. I gotta laugh, you know, because, yo, that's how it goes sometimes, you know. I shouldn't even leave these in, but, yo, I'm showing a lighter side, yeah. If you can't laugh at yourself, then you're far too serious. But, yo, listen, yeah, it doesn't always run as smoothly as it sounds in the videos. I thought I'd just leave it in. It doesn't always go as smooth as it sounds in the final cut. Remember that. What emotions does the thalamus control? The thalamus is part of the limbic system, which is considered the emotional centre of the brain. A growing body of research shows that the thalamus function is related to your moods and may be implicated in mood disorders such as major depressive disorder, or MDD for short. So, if the thalamus does not regulate the sense of smell, then what does? This would be olfaction. The olfactory system is the sensory system for the sense of smell. involving specialised olfactory receptor cells in the nose that detect odour molecules, odorants, and send signals via the olfactory nerve. These signals then go to the olfactory bulb and then to other brain areas for interpretation, playing crucial roles in survival, taste, memory, and emotion. What are the two types of olfaction? Olfaction is one of the special senses directly associated with specific organs. Most mammals and reptiles have a main olfactory system and also an accessory olfactory system. The main olfactory system detects airborne substances, while the accessory system senses fluid phase stimuli. Olfaction. It's unique as it bypasses the thalamus, connecting directly to the limbic system, which explains its strong link to memory and feelings. Here's a detailed explanation. Olfactory epithelium. A patch of tissue in the nasal cavity containing receptor neurons that bind to odorants. Olfactory nerve. This is the cranial nerve 1. Axons from these neurons pass through the skull base, the cribriform plate, to the olfactory bulb. Olfactory bulb, a relay station where receptor cell axons synapse with mitral cells. Olfactory tract, carries signals from the bulb to the olfactory cortex. Brain connections, signals go to the limbic system, being emotion and memory, and the cerebral cortex. This would be a conscious smell perception. Functions. Detection, identifies airborne chemicals, being odorants. Survival, detects food, toxins, mates, and dangers. Taste enhancement, strongly influences flavour perception as smell and taste work together. Here's a detailed explanation. Functions. Memory and emotion. Direct link to the limbic system creates strong smell memory associations. This is the Proustian effect. Warning system. Alerts to hazards like gas leaks or fires. How it works, the mechanism. Odorant molecules enter the nose and bind to specific G protein coupled receptors on olfactory neurons. This binding triggers a signal cascade, depolarizing the neuron and creating an electrical signal. These signals are sent to the olfactory bulb, where patterns of activation identify the specific odor. Information is then relayed to higher brain centers for interpretation and integration with other senses and memories. What happens if the olfactory nerve is damaged? Lesions to the olfactory nerve and/or to the olfactory pathway can lead to the following signs and signals of disruption. Anosmia. This is the loss of the sense of smell. Hyposmia. You'll be realising you have a decreased ability to detect smell. Hyperosmia. This would be an increased sensitivity to the sense of smell. Right, back to the main video after that little detour. How do you know if the thalamus is damaged? Signs or signals of a thalamic stroke vary depending on which part of the thalamus was damaged. You will be seeing muscular weakness or weakness of one side of the body. So as well as the past few just mentioned, you'll also be seeing vision changes, you'll be having trouble swallowing, there'll be a decreased level of consciousness and also memory loss. There'll also be trouble with thinking skills, you'll be seeing confusion and also impaired judgment. Yeah, that's correct. You need to be thinking twice. And when it comes to impaired judgment, don't just jump to the first act that you might think is the right thing to do. could turn out to be the worst thing you could have done. You may also be seeing regular agitation, also feeling a burning sensation. So what foods are good for the thalamus? Research shows that the best brain foods are the same ones that protect your heart and blood vessels. These will be including the following: green leafy vegetables, fatty fish, berries, walnuts. Here's a quick reiteration. Why the thalamus is essential. Sensory relay. Almost all sensory information, being sight, sound, touch, taste, but not smell, passes through the thalamus before reaching the cerebral cortex for interpretation. Consciousness and alertness. It plays a crucial role in regulating arousal, wakefulness, and the level of awareness, forming vital circuits to the cerebral cortex. Motor control. It relays motor signals, influencing movement and coordination. Consequences of damage. Severe dysfunction. Damage can lead to sensory loss, things like blindness and chronic pain, motor problems, memory impairment, attention deficits, and personality changes. You can end up in a coma or even worse. So complete destruction of the thalamus is usually fatal or results in a permanent coma, highlighting its indispensable role. While some brain areas can sustain damage, the thalamus's central role as the gateway for information and regulator of consciousness makes it impossible to live without it. Right, so we've had the little reiteration about what happens if it's damaged. So how long does it take for the brain to repair itself? The brain can take anywhere from a few weeks to several years to heal, depending on the severity of the injury, the effectiveness of the medical treatment, and also the individual recovery factors. So what kind of GP or medical professional performs a thalamotomy? A thalamotomy? Thalamotomy? Check out that for a word. Wrap your lips around that one then. I've never seen that word before. A thalamotomy. You know, I could just take those parts out, you know, but I find it amusing. You may not, but for me, it kind of spices up the video, like. Right, so let's get serious. We're not too serious. Anyway, let's get on with it. What kind of GP or medical professional performs a thalamotomy? The procedure, thalamotomy, involves a real-time interaction with a neurosurgeon and the patient, who is awake and responsive throughout the procedure. What are the three types of thalamus? The thalamus is a paired structure located in the centre of the brain. Each side can divide into three groups of thalamic nuclei. Now, to start with, these are the A lateral nuclear group, the A medial nuclear group, and also, last but not least, the anterior nuclear group. What role does the thalamus play in anxiety? The paraventricular thalamus, or the PVT, check out that for a word, wrap your lips around that one then, mediates pain information by directly connecting with pain-related networks such as the amygdala and the prefrontal cortex. Additionally, the PVT processes information related to stress, anxiety, and emotional responses, interacting with other neural circuits within the brain. Why is the thalamus so important? Two new studies show the thalamus, the small central brain structure, is often characterised as a pit stop for sensory information on its way to the cerebral cortex. It is heavily involved in sensory processing and is an important conductor of the brain's complex orchestra of activity. What is the function of the thalamus hormones? It contains peptidergic neurons that secrete hormones through the pituitary gland to control endocrine functions. The hypothalamus the body's hormonal command centre. The hypothalamus is key to the endocrine system, balancing hormones. It sits below the thalamus and above the pituitary gland. This small area controls many body functions. Which hormone is responsible for memory loss? That would be thyroid hormones. The thyroid hormone imbalance, such as hypothyroidism or hyperthyroidism, can affect memory and cognitive function. Hypothyroidism is characterised by a low level of thyroid hormone and may lead to difficulties with concentration and memory. What are the 4 hormones released by the brain? Endorphins primarily helps a person deal with stress and reduce feelings of pain. Serotonin, this is a mood stabiliser, well-being and happiness. Dopamine for pleasure, motivational role in brain's reward system. Oxytocin bonding, love and trust. Oxytocin, this hormone assists in the birthing process. It stimulates uterine muscle contraction and in lactation, the release of breast milk. It's also thought to play a role in human bonding, arousal, trust, recognition, the sleep cycle and feelings of well-being. What calms down the thalamus? According to health professionals, boosting serotonin in your brain is the key for calming the thalamus. Right, so we're going to take a little detour considering we're talking about the brain. What causes 70% of dementia? Alzheimer's disease is the primary cause, responsible for roughly 60 to 70% of all dementia cases, characterised by brain plaques and tangles, while other significant causes include vascular dementia from reduced blood flow. Also, Lewy body dementia, this is protein deposits, with many people having mixed forms. So what are the causes and the statistics? Alzheimer's disease accounts for the majority, which is 60 to 70% of dementia cases involving amyloid plaques and tau tangles that destruct brain cells. Vascular dementia. This results from strokes or poor blood flow to the brain, affecting about 15% of the cases. Lewy body dementia, caused by Lewy bodies in nerve cells. These are protein deposits, leading to hallucinations and sleep issues, making up around 5% of cases. Mixed dementia. This often occurs in individuals who have a combination of different dementia types, like Alzheimer's and vascular dementia. This is according to the research which has been done by the World Health Organization. Other contributing factors. Brain injury. Severe head trauma can increase the chances of this arising. Lifestyle. So high blood pressure, diabetes, high cholesterol and also smoke inhalation factors particularly for vascular dementia. Genetics. Family history also plays a significant role. So in essence, Alzheimer's is the most common driver, but dementia is complex, stemming from many debilitating ailments, damaging the brain. What vitamin deficiency is linked to dementia? Research results confirm that vitamin D deficiency is associated with a substantially increased risk of all-cause types of dementia and Alzheimer's disease. Can you reverse dementia if caught early? Dementia itself isn't typically reversible if caught early, as it's caused by progressive brain diseases, but reversible conditions that mimic dementia, like vitamin deficiencies, thyroid issues, or fluid buildup, can be cured. Early diagnosis allows for managing risk factors like blood pressure or diet, to slow progression or improve signs with lifestyle changes and emerging treatments, preventing further damage. Early action is crucial for managing signs and signals of deterioration, accessing new disease-modifying given prescriptions and maintaining quality of life. Why does early diagnosis matter, even without a cure? So we start with treating underlying causes. Some dementia-like signs stem from treatable issues like B12 deficiency or normal pressure hydrocephalus, which can be reversed with specific interventions. Slowing progression. For Alzheimer's, vascular dementia and other types, managing heart health, diet, exercise and given prescriptions can slow cognitive decline and prevent new brain cell loss. Accessing new treatments. Early diagnosis is vital for eligibility in clinical trials and for newer given prescriptions which can slow disease progression. Treatment. A surgical shunt, specifically a ventriculoperitoneal or a VP shunt, is typically placed to drain excess fluid into the abdomen. A ventriculoperitoneal. Check out that for a word. Wrap your lips around that one then. I gotta laugh, you know. Why am I finding these long words exciting? I don't get it. Why? Ventriculoperitoneal. That's a mad word, isn't it? Check it out. Wow. Wrap your lips around that one then. You know what it is? It's brain stimulation. This is actually what you're witnessing now, you're listening to. I don't normally find these kind of words, exciting. But for some reason, it's just having an effect. It's brain stimulation. It's great for you. You should try it sometime. Try reading something. Prognosis. Early treatment can improve signs and signals or reverse the condition, but untreated MPH can worsen over time. I know you like these vocals, you know. Listen again. What she say? Rewind selector. One more time. MPH versus other conditions. So unlike Alzheimer's, MPH dementia usually presents alongside mobility issues first. Additionally, unlike typical hydrocephalus, the pressure within the skull does not reach dangerously high levels. While you can't reverse the neurological damage from diseases like Alzheimer's yet, catching an early sign is crucial for managing the risk, accessing new treatments and implementing lifestyle changes that can significantly impact the course of the disease. Back to the video at hand after that little detour. What are the 5 signs your brain is in trouble? 5 key signs your brain might be in trouble include significant memory loss, disrupting daily life, persistent confusion about time or places, severe difficulties with planning or problem solving, along with unexplained personality or mood changes like withdrawal or irritability, and trouble with language, meaning finding words, or familiar tasks, all pointing to potential issues like dementia or brain fog. Here are 5 common indicators. We'll start with memory loss, disrupting daily life. So forgetting important recent events, dates or instructions, and needing to rely on notes or family for things you used to manage easily, this is a red flag. Difficulty planning or problem solving. Struggling to follow a familiar recipe, manage finances or plan an event, and experiencing slow thinking suggest cognitive decline. Changes in mood or personality. So becoming easily upset, withdrawn, anxious, depressed, or showing unusual irritability, especially if it shifts from your normal self, can signal brain issues. Trouble with language or visuals. So frequently losing your train of thought, struggling to find the right words, or having problems judging distances and directions, like getting lost in familiar places. These are all key signs. Confusion with time or place. Losing a mental grasp of dates, seasons, or finding yourself in a place not knowing how you got there. If this goes beyond typical age-related forgetfulness, it can be concerning. When to consult with a verified health professional. These signs, especially if they worsen or significantly interfere with your life, may call for a visit to a healthcare professional, as they can indicate many conditions from brain fog to dementia. Now, even though this video we're going over the thalamus, there is no harm in just quickly inputting some information on these two debilitating and degenerative brain conditions. Many of us may know or have close relationships with those going through these types of situations. I myself have had a great nan who would have been my kid's great nan. I'd visit any time I would go to my hometown, just like I would with my nan. I'd pass by unannounced, quick check up to see how they were. She would have to ask, just as a reminder of which grandson I was. There's many of us. She lived past 100, and I was blessed to be able to take my eldest son over for a good few times and get some pictures for memories and times past. Also to make sure my son knows where he's coming from, his roots, and meet the first of the family to come over to this country with Grandad. With me being one of the older ones in the family, I remember when both their minds were fresh, immediately knowing who we were whenever we went over to the house or had a family function. So I was one of those who saw the decline. Seeing this happen, mild dementia, it can be heartbreaking, but you're old enough to understand it's a part of life when you reach a certain age. Your job is to try and slow it down. Now, for the younger ones in the families, it can be confusing as to why they can't remember who they are, so you'd have to explain and give them that reassurance. Right, so I don't sit here and go on like I know it all, you know. While I'm putting out these videos, I'm also educating myself. Understand, this is just me mainly passing on information. Some information I may also need myself. We're on a level playing field here. In other words, I do not know it all. There's no bravado in this thing here, you get me? I also need to learn and take in new information. Do not feel spoken down to. We're in this thing together. Right now, I'm just one of your precision instruments for information. What drink is good for brain memory? Drinks that enhance brain function. Coffee, green tea, berry juice, kombucha tea. Green smoothies, turmeric tea, beetroot juice, and ginseng tea. Does the thalamus control appetite? The hypothalamus is the portion of the brain that controls hunger and the hormone cortisol, which can create hunger cues. When you eat, your stomach expands. This signal notifies the hypothalamus that it's time to stop eating. What is the best vitamin for seniors? Vitamins, minerals and nutrients for seniors over 70. We'll start with calcium. Calcium supports bone density. and helps to prevent osteoporosis and fractures in seniors. Vitamin A, vitamin B6, vitamin B12, vitamin C, niacin, folate, and other B vitamins. So, in summary for this video, we'll go over the main points for the thalamus. This should freshen up the memory of past segments throughout the video. These will give you a good understanding of this particular area of the brain's limbic system, so you can know what to look for signs and signals. The thalamus is a pair of egg-shaped grey matter structures located deep in the brain above the brainstem, acting as a primary relay station for sensory and motor signals travelling between the body and the cerebral cortex. It regulates consciousness, sleep and alertness, filtering information to prioritise attention. Sensory relay processes and relays input from all senses except smell to the cerebral cortex. Motor control relays motor information to aid in movement coordination. Consciousness and sleep plays a crucial role in regulating wakefulness and alertness. Cognition and mood involved in memory, emotional regulation and attention. Structure composed of numerous nuclei that specialise in different functions and constitutes most of the diencephalon. The diencephalon is defined as a mass of grey matter located between the optic chiasma and anterior commissure to the midbrain, comprising of the thalamus, hypothalamus, subthalamus and the epithalamus, and playing a critical role in consciousness, organ functions and homeostasis. The diencephalon is deep beneath the cerebrum and constitutes the walls of the third ventricle. The diencephalon can be described as a region of the brain with thalamus in its name. Location: the thalami are situated in the forebrain, one in each hemisphere, acting as a bridge between the cerebral cortex and the midbrain. What happens if it's damaged? Damage to the thalamus can lead to severe issues including coma, sensory deficits, or movement disorders. The thalamus is the brain's central relay station, directing most sensory and motor signals to the cerebral cortex, playing a vital role in sensation, movement, attention, sleep, and memory. Each part of the thalamus, called a nucleus, has a specialised job processing different types of information. Now you know and understand how the thalamus plays a crucial role in brain function. It's vital that you take care of this area of the brain, which sits alongside a few other parts making up the limbic system. Stay alert, be aware, stay sharp. Happy navigation. Good luck.